Hello everyone, welcome back to my channel. It's a brand new day. Let's go of the past and grab a new lens to life. So today we are going to go straight ahead and talk about how to ace your pharmacology exam. The first thing I'd like to talk about is reading to understand. You need to study to understand in order to apply it into your daily life, in order to teach another person. So don't just study to pass your exam. Study to apply it in your daily life. As you are reading, try and link these medications and its related diseases to any individual you may know that have these medical issues. You have to think about how to educate them should in case they try to discuss their problems, their medical issues with you. You have to know the side effect of these medications. You should be able to teach them. By so doing, anytime this medication is mentioned, that individual comes to mind and you'll be able to recall every single information on this medication. So this is one of the best things that you can do. Secondly, know the classes of this medication and the categories they fall under. For example, I put down antihypertensive medications. So under that, we have a class such as ACE inhibitors. And under this class, I wrote something down as captopril. Most of this medication under this class actually ends in pril, P-R-I-L, like benazepril, fosinapril. So just to mention a few, this is something that you really want to know. So immediately you see any medications and you haven't even heard it before, you make sure you check the last part and immediately you see the pro. You know that, oh, this is an ACE inhibitor. So this is something that you can also pay attention to if you start studying. The second example I put on the clipboard is actually a beta-adrenergic blockers. And these medications actually end with LOL, ha ha ha, low. That's what I mean, I actually say. So immediately you see or hear metoprolol, propanolol. So ending with the LOL, I've actually bolded this. You should know that all these medications actually falls under beta-adrenergic blockers. So even if you haven't heard or seen any of this medication, by checking the last 3 letters, you'll be able to know that they fall under this class. And the third one that I spoke about is calcium channel blockers. And with this one, you actually wouldn't have the last one. So this is some of the medications that you may want to actually have it in mind or have it off heard. So we have something like denifedapine, verapamil, just to mention a few. And I put this one down so that we will be able to figure out something which I'm about to discuss soon. The next thing I'd like to talk about is mnemonics. This actually helps you to keep things in mind. And as you can see on the clipboard, I have actually underlined the A from ACE inhibitor, B from the beta-adrenergic blockers, and the C from the calcium channel blockers. So you can see A, B, C. So immediately you think about antihypertensive medications, you can just think about A, B, C. Then you know the classes that, oh, A stand for ACE inhibitor, B stand for beta blockers, C stand for calcium channel blockers. That's something that could also help you. So aside trying to maybe buy these mnemonics from other sites, you can also try and create yours in order to save some money. The next thing you also want to do is to make flashcards. Write the name of these medications, their side effects, so that you remember them. Try and handwrite so that you can recall everything that you put on there. Some people also decide to buy it from Amazon and other places, but I will encourage you to write your own thing. Last thing I like to pinpoint is about how you study. Do you study well by yourself or in a group? You know which one will help you. Don't try to fit in a space where you are uncomfortable. Also, don't cram just a few days to exams. And don't wait to get a blueprint before you start studying. Try and study at least an hour or 2 every day in order to keep up with the class. If it is too much for you, use the professor's PowerPoints in order to help direct you to the right point where you need to study. And if possible, ask your professor if you can record him or her in order to know what the professor actually stressed on in class. Pay attention to that. The last thing that I would say is that don't forget to use your drug guide. It is very helpful. And if you don't get a passing score on your first exam, it's okay to cry. Forgive yourself. Figure out what you did wrong. Talk to your professor if possible. Ask a colleague who did well for help. And don't try to cry all day. Avoid telling your grade or scores to people as well. All that I will tell you is that you got this. It's going to be okay. I hope these few points help somebody out there. Kindly subscribe to my channel, and if you have anything you want to add, put it down below. And if you want to ask any question too, go ahead and comment. Thank you.